Here and Now, the program featuring the news and interests of the African American community. Here's your host, Sandra Bookman.
Coming up on this half-hour edition of Here and Now, how popular weight loss drugs are impacting the health of communities of color, and the positive changes go far beyond just shedding pounds. The nonprofit for teens using high-tech hydroponic farming to help reduce food insecurity in New York City. And a first-of-its-kind HBCU early college prep high school in Queens. That's all ahead on Here and Now. The rise in the use of certain weight loss drugs is being credited with also improving heart health, specifically decreasing incidence of heart attacks and strokes, ultimately saving lives. For high-risk groups, including African Americans, this could be a game changer. Here to tell us more is Dr. Icilma Fergus, Director of Cardiovascular Disparities for the Mount Sinai Health System. So nice to see you again, and thank you for always being willing to sit down and talk with us.
Thank you. Thank you so much for having me, Sandra. It's always so, great and wonderful to be on your show and to just talk about the issues that really affect, our communities that are really so impactful when we tell the story. So thank you again for having me.
Yeah, you help us get the information out. These drugs, Dr. Icy, I know that's what lots of folks call you. They're like miracle drugs. It's almost as if they work on a little bit of everything. So talk to me about how it came about that we are seeing drugs that were initially described, I think, for people that had diabetes. Suddenly they were useful as weight loss drugs, and now suddenly it may work as well when it comes to keeping your heart healthy.
That's absolutely correct. So these drugs, they're called GLP-1 inhibitors or glucagon-like peptide inhibitors. And I know everyone and semaglutide and tirzepatide. So people may be more familiar with Ozempic. That was initially, used for treatment of diabetes. And the weight loss component of that is called Wegovy. They're the same medications, semaglutide. And then the newer version, so to speak, that targets another GLP receptor is the tirzepatide. So people have heard of Zepbound, of course, and Mounjaro. Now, treating these patients initially, it was seen that not only was their A1C getting better, but people, when they lost weight, their blood pressure got better, their cholesterol got better, they felt better. And Sandra, when people lose weight and they're able to do more, they feel better. So I think, the happy hormones sort of, kick in as well. But there are definitely several studies that showed the benefit of these GLP-1s with cardiovascular adverse, what we call the risk factors, or the major adverse events, which we call MACE, cardiovascular events, which is MACE. And one study called the SELECT trial looked at over 17,000 individuals over 5 years. And what did they see? It was a 20% reduction in cardiovascular risk events. So again, the blood pressure, the cholesterol, of course, the blood sugar, diabetes, the A1Cs got better. People felt better. They were then able to move more, exercise more, feeling good about themselves. They're dressing better, and of course, having a better outlook on life.
Now, I know that there are ongoing studies to look, more specifically at exactly what these medications do once they get in the body to determine how it is that they are, having all these miraculously seeming outcomes. So is it about the weight loss itself that gives us the better results, or is there another mechanism that these GLP-1 drugs work on that are responsible for these positive changes?
So that's an excellent question. Let me just say that what the GLP-1s do, essentially how they work, again, the glucagon-like peptide inhibitors. But I'll tell you, what ends up happening pretty much is you feel full because they slow down the motility of the gut motility of peristalsis. So the person feels full, so they're not eating more. And also the brain gets the message not to eat too much. So it's not like a beta blocker or an ACE inhibitor that works on the RAS system or the sympathetic nervous system or anything. Simply it causes you to not eat, and because you're not eating as much, you lose weight. But the fat, Sandra, the fat that's around in the body is detrimental. So when you have fat cells that are floating around and you have a lot of gut fat or abdominal fat, visceral adiposity, that's an independent risk factor. When you have fat surrounding your heart, it's an independent risk factor. And when fats around, you have increased inflammation, increased cortisol, and a lot of these negative enzymes that then cause your heart rate to be high, your blood pressure to be high. And also, of course, if you're not eating as much, things like your blood sugar and your cholesterol will go down. So it really is as a result of the weight loss itself and the reduction of fat that patients or individuals are experiencing these great benefits.
Now, I mentioned high-risk groups early on in the intro to you. African Americans fall into that group. How do you determine who would be a good candidate for trying this GLP-1, one of these drugs, if what you're after is helping them with their heart health issues?
Right. These days, so before we had an issue with insurances not covering, but now recognizing the cardiovascular benefits, for the most part, many people are able to get the drug. So if I see someone who's come into my office, they just have multiple risk factors. One of them, of course, being weight. So, Sandra, we look at what's called the body mass index. So 25 body mass index, which is your weight to your height, is considered to be fine. But once you start going above that and you get to a body mass index of 30, that's considered being obese. So when I do my vitals on my patients and I see that they have a body mass index that is increased along with having risk factors, I know that certainly weight loss is one of the main ways to go. Now, when you look at all of the clinical guidelines and studies, the very first thing they talk about, of course, is lifestyle intervention. So you always tell your patients, besides getting on medications, they need to change their lifestyle for the better. So more exercise, more walking, more eating better, sleeping more, reduction in processed fast food and processed foods, alcohol, etc. But when a patient comes in and I'm asking them to do all of this, one of the key things obviously is to lose weight, which will then help all of this. And it's typically very difficult for some of the people in communities who live in urban communities to lose weight, because going to a gym could be quite expensive.
Mm-hmm.
And people talk about not being able to walk in the evening or the night, or the sidewalk, it's too busy, it's too crowded, there are cars, there's crime, there's not a park. So it's been tough for people to do the amount of exercise that they need to do to lose the weight. And also buying some of the foods themselves, is astronomical. So what these GLP-1s do is like they get things started. You're eating less, you don't feel full, and so you lose weight. So you don't have to buy as many multiple things that you need to buy to eat. You just need to buy some of it, not all of it. Okay. You just need to do a little bit of exercise. So you don't have to do an hour a day, to just lose weight, because we do know that to maintain your body, the American Heart recommends 30 minutes on most days of the week to maintain the weight. But to lose weight, you got to do double that amount of exercise. And that's difficult to do.
Can I ask you, how long do you recommend patients stay on this medication? And are there any rules for getting off of it?
Okay, that's also an excellent question. Listen, Sandra, I've had people lose 64 pounds in 9 months. So I'm very careful about getting my patients onto the drug, maintaining the drug, and then, getting them off. Some people do need to stay on the drug, particularly, for instance, if they have diabetes and you want to maintain that. But what I tell people is, let's talk about the desired weight that you're trying to get to. So that's number one. But when I'm seeing that their blood pressures are improving, their cholesterol, their sugars, they're being taken off of other medications that they were on initially to manage these risk factors. But let's say that we've now gotten them off the meds and you're at the ideal weight. What we do, Sandra, is to spread it out. So you don't just stop cold turkey, because if you do, then the desire to eat comes back. Many of my patients tell me that if they're off of it for 3 weeks, the desire to eat comes back. So it's best to sort of wean yourself off of it instead of going cold turkey. But for some patients who who want to maintain their weight, they take it every other week. But of course, there are some people who will have, their body got used to eating better, eating less. And so they're able to get off the med and live a, relatively normal, lifestyle without regaining the weight. So I think it depends on the individual, but I would recommend not stopping cold turkey, because then, people start to get hungry again and start, some of the bad habits again.
And you really should be taking these medications with the doctor's supervision anyway. Realizing that there's a lot of studies still underway, since we're still figuring out some of the positive results of these medications, what do we know about long-term side effects?
Okay, that's a great question. So, when a drug comes onto the market, it has been through several clinical trials already, phase 1, phase 2, phase 3, before it goes to a person. So they look at, first animal studies, then they look at, a group of individuals, then they look at a larger, group of individuals, like over thousands. And so long term, we know that it's relatively safe. One of the things that we ask people is to ensure that they don't have what's called thyroid medullary carcinoma, which is a type of cancer, or multiple endocrine syndrome. Those two in animals have been shown to not be the type of individual that you want to have on this medication. So that's one of the main things. Besides that, Sandra, we do a baseline set of labs to kind of know where people are. And typically long term, you're just going to see a benefit. We have not seen any adverse outcomes in terms of long-term development of cancer or anything like that. But there are side effects or adverse effects that can be encountered, especially if you're not working under the direction of a doctor. So one of the things, for instance, is, of course, that we talked about slowing down gut motility, or peristalsis, which is the food moving through the GI tract. So some people may suffer from constipation or some other GI symptom. And if you are someone who will be undergoing surgery, we want to stop that drug at least 1 week before to ensure that, that the gut is working and that medications that we give are able to work through the gut. So it comes with, certain, directives, and certainly should be under the care and the guide of a physician.
And I think that is an important point to make. Dr. Icilma Fergus, Director of Cardiovascular Disparities at Mount Sinai Health. I'm going to give people your website, mountsinai.org, because they can find out more information about you and all the way to your cardiologist, a very, very good one, I might add. So they can find out more about this and any other questions they might have. If you go to mountsinai.org, take a look at their menu, and you'll be able to get the information you need. Thank you so much for talking with us this afternoon.
Thank you. My pleasure. I'm glad to be here.
Yeah, I got lots more questions, but we're going to save them for the next time. All right.
Okay. Great. Thank you.
We'll be right back. One in 4 children in New York City experience food insecurity, and monthly visits to food banks and other food assistance programs has grown by about 75% over the past 5 years. Teens for Food Justice is addressing this growing need through school-based hydroponic farming. They're not only able to provide local, sustainably grown produce, but also a real model for the future. And here to tell us more this afternoon is Elisa Gardner-Vasquez, a senior farmer educator for Teens for Food Justice, along with volunteer Huascar Soriano. Thank you both for being with us this afternoon. This is absolutely fascinating. It really is. Now, you got involved with the program as a volunteer, you say 12 years ago.
Yes.
What is it about Teens for Justice for Food Justice that obviously spoke to you?
Yeah, well, thank you for having us, by the way. What spoke to me about Teens for Food Justice, I was a 16-year-old that didn't know what direction she wanted to go in life, and I had taken a College Now course that was outside ecology gardening and environmental justice, and I had connected to a volunteer opportunity with Teens for Food Justice and volunteered for a year and learned so much through the program and gained so much knowledge that I used in my personal everyday life and brought back to my own family. And I just wanted to continue that, so I came back as a mentor the following year, and then eventually as Teens for Food Justice's first farmer educator for our first farm in Brooklyn.
Yeah, and I should mention that you have a bachelor's degree in urban sustainability and you minored in earth and environmental science. So this is all really in your wheelhouse. And what I love about this program is that when, we talk about it, and for a lot of people, it's pie in the sky. Now, how are they doing that? You guys have real results. So why don't I have you first explain to folks what hydroponic farming is?
Yes. So hydroponic farming is growing food or plants without the use of soil. So traditional agricultural farming happens in the ground, but in New York City, we don't have that kind of space. So we have to think vertical. We have to think indoors. So we have controlled environmental agriculture and hydroponic systems that grow 10,000 pounds of food per site per year.
Which is absolutely fantastic. And right now you've got, you serve 22 schools, am I correct about that?
Yes, 22 schools on 8 campuses across New York City. So Manhattan, Brooklyn, the Bronx, and the Queens, and in Denver, Colorado as well.
Okay, and 60,000 pounds of produce annually?
Yes, annually from all of our farms collectively, we produce 60,000, and we're looking to open up 2 more farms by the end of this year, which would bring us up to 75,000 pounds of food in a year.
It impresses me if it doesn't impress anyone else. And I want to bring you into the conversation, Waskar. You are a college freshman.
Yes.
And you're a volunteer with the organization. What attracted you to Teens for Food Justice?
Well, I was a student at Urban Assembly Media High School in the MLK campus. I started to help out as part of a horticulture class where we learned the processes from seed to harvest. And after I graduated from high school, I decided to continue to come back and volunteer because I saw a change in the community. I saw that we were feeding them healthy produce that was readily available and that was fresh and of good quality and nutrition.
And you really touched on an important part of this program, because it's just not about the fascination with being able to grow things hydroponically. It is really about sort of almost a wholesale change in a community. You're talking to people not only about growing their own healthy food, but also eating healthy. It's really a change in lifestyle. That's an important part of this program, right?
Yes, absolutely. So our students, they'll come in through a science class or a math class or English, history. We touch upon all subjects. We even offer after school and occupational therapy classes, and in all of those classes, the students, they learn the hands-on farming aspect, but then they learn to cook with the food that they grow. So they have ownership over the plants as they're growing, and they get really connected, and then they make a meal with that food that they had ownership over. And really, you see the change, you see the excitement over trying something new and something fresh and very healthy. A lot of the kids, they just become very excited about the farm.
And my understanding is a lot of the places that you are in areas that we think of as food deserts.
Yes.
There's not a whole lot of, or not enough, I should say, fresh produce and access to these kinds of things. So it makes it even more important to bring the community into the process.
Yes.
And know that they're not dependent on someone from the outside coming in and making it better. They can make it better.
Correct. The students, they take ownership over the farm. They really learn how to maintain and take over the farm themselves.
And I understand that you are planning to launch 2 more farms, which means you'll have a total of 11 by winter, the end of this year.
Yes.
Mm-hmm. That's got to be exciting.
Yes. So it's always amazing to add a new school. Each farm is unique in its own way, and it really embodies the community, the school community within the farm.
And before we go, I really wanted us to take a look at this. Is just a little bit of the protest. Now, on my right here, that's romaine lettuce, right?
Yes.
Okay. And in the center,
we have some broccoli microgreens, and right next to that, we have some basil plants. So these are just examples. Waskar, if you want to take the lead
Of the kinds of
explaining
things
what's
that you
going
guys
on
grow?
here.
As a student of TFFJ, we not only work in the farm in the hydroponics process, we also make arts and crafts activities where we take something that might otherwise not have much of a use and we make it into something new, giving it a new life. For example, this water bottle could have ended up in a landfill. And now it is a DIY hydroponic system,
Okay,
homemade.
makes
You put
sense.
water, the roots flow down and they grow. We also learn of the microgreens. We plant these from seed and we harvest them, we use them. Not only are we learning from the beauty that is the growth of a plant from seed and its beautiful process, but also how to take care of it, and most importantly, how to use them in an everyday setting. You can put this in a sandwich, a salad, cook with it, and you are not only learning about nutrition, you're also learning about taking better care of yourself through your own diet.
Yeah, you put the power in your hands. So my producer is going to strangle me because I need to wrap up. But I want to tell folks how they can get involved with the organization, whether it's volunteering or in some other way.
Yes, so you can go to our website at www.teensforfoodjustice.org to find out more, to contact us, to donate, and just learn about our program and hopefully spread the word. Hopefully anyone watching this today will advocate for food justice in their own communities after seeing this.
I think that it is just a fantastic idea, and I congratulate both of you for being involved with this. It really can be life-changing.
Yes.
Thank you very much.
Thank you.
Thank you.
We'll be right back. What do Spike Lee, Oprah Winfrey, Kamala Harris, and Good Morning America's Michael Strahan have in common? They're all successful graduates of historically black colleges and universities. Now, one woman in our area is helping hundreds of students blaze their own trail toward academic success and HBCU culture.
Dr. Asia Johnson.
Dr. Asia Johnson.
Dr. Asia Johnson.
Dr. Johnson.
I am Dr. Asia Johnson.
Dr. Asia Johnson, an innovator in education, has founded a school that will be the first of its kind in the country. HBCU Early College Prep High School opens in Southeast Queens this fall.
Southeast Queens is a vibrant and culturally rich community, but like many predominantly black and brown neighborhoods, our students face systemic barriers to higher education and access.
Dr. Johnson is breaking those barriers, motivating a generation of students with new opportunities.
The students in Southeast Queens will receive a program that allows them to get an associate's degree from an HBCU at no cost to them. It also guarantees them admission to Delaware State University after they successfully complete their associate's degree.
And students are already excited about their futures.
I was just once in a position where I wanted to do something big in life, such as attending to HBCU high school, and now others could look at me as inspiration, like, oh, Peyton went to this is Peyton's reaction, I can follow in her footsteps and be like her.
It means a lot to me to know that I can inspire a lot of young people of color to follow in my footsteps, or to even be an inspiration to people just as how people were to me, because it's very impactful.
Undaunted and emboldened, these young scholars know full well that they are on the cusp of making history.
We're setting the tone for the school. We're building the name for the school.
I'm stepping out of the box. I'm doing something out of the ordinary.
As for their new principal,
I also know what it takes to be able to create a school where students feel loved, valued, and cherished, and affirmed. The potential was already there. The talent was already there. We were just waiting for something to happen for them. This is now. This is the moment. This is the opportunity to give it to them, because their genius can't wait, and we can't keep pushing our kids off to the side.
thank you for joining us on Here and Now. If you missed any portion of today's show, you can watch at abc7ny.com/hereandnow. or listen to our podcast wherever you subscribe. If you'd like to comment or share your story, email us at hereandnow@wabc.com or follow us on Facebook and Instagram. I'm Sandra Bookman. Enjoy the rest of your day.